Bismillahirrahmanirrahim. Pathophysiology of teeth is discussed in this video. The purpose of the teeth is to prepare food for digestion by cutting, grinding, and mixing. And also the another purpose is to increase the surface area for the digestive enzyme action. It prevents injury to the GI tract and facilitate stomach emptying and intestinal transit. The teeth functions, the anterior teeth, they are responsible for cutting action, while the posterior teeth are responsible, the molar teeth are responsible for the grinding action, and the incisors of frontal or anterior teeth, they have got about 55 pounds force on the food, while the posterior one or molars, they exert about 200 pounds of force on the food. So there are neural control of this mechanism. The most chewing muscles are innervated by the motor branches of cranial nerve 5 or trigeminal nerve, and the brain centers are located in the brain stem nuclei that control the rhythm of the chewing, and there is also a stimulation of the reticular area or taste center in the brain stem that will result in rhythmical chewing. Hypothalamus, amygdala, and even the cerebral cortex, they are responsible for the chewing movements. So whenever there is a bolus in the mouth, that inhibit mastication muscle and jaw drops, and this jaw drop will result in a stretch of the jaw muscles, and there is rebound contraction. As the jaw raises, teeth closes on the bolus and the bolus is compressed. Compression inhibits the mastication muscles and the jaw drops again. This cycle repeats until food is adequately broken down, and this chewing process is essential for food and raw vegetables to break the cellulose wall, and then the digestive enzyme, they act only on the food surfaces. That will result in fine grinding increase, uh, or this will also increase the digestion rate. The crown, neck, and roots are the different parts of the tooth. The crown is the portion that protrudes out from the gum into the mouth, while the neck is the collar between the crown and the root where the tooth is surrounded by the gum. And the root is the portion within the bony sockets of the jaw. While the functional parts of the tooth are enamel, pulp chamber, dentin, and cementum. Enamel is essentially the tooth's natural armor. It is the hardest substance in the human body that is created before the tooth even erupt by specialized epithelial cells that are called ameloblast. This formation of this enamel only happens before eruption. Once the tooth appears, no new enamel can be produced, and its position is on the outer surface of the tooth. It is composed mainly of large, dense crystals of hydroxyapatite that are calcium phosphate with trace ions like carbonate, magnesium, sodium, and potassium, and embedded within a fine, strong protein fiber meshwork that is about 1% of the enamel mass. Similar in properties but not in chemistry, to keratin in the hair. The enamel is harder. It is far harder than dentin due to its dense crystalline structure, and it's the unique protein network is highly insoluble and resistant to the enzymes and corrosion, making enamel durable against everyday wear and chemical attack. Dentin forms the main structural body of the tooth and provide both strength and resilience to the tooth. It is composed primarily hydroxyapatite crystals, calcium phosphate, similar to bone, but it is denser, and it is embedded in a strong meshwork of collagen fibers, and these are similar in composition to the bone, but different in cellular structure. There is histologically no bone cells. They lack osteoblast, osteocyte, osteoclast, and vascular nervous spaces. Instead, it is the deposited and maintained by odontoblast, a layer of specialized cells lining the pulp cavity. These cells, they send processes into microscopic dentinal tubules to nourish and repair dentin. And then there is high compressive strength from the calcium salt that will result in resistance against the crushing forces. So high tensile toughness is achieved from the collagen, and that result in resists in cracking or shattering when the tooth bite hard substances. So here in this picture you can see that the enamel is composed of large hydroxyapatite crystals embedded in a protein meshwork, and it is extremely hard and produced by amyloblast, while dentin, that is the main structural body of the tooth, and it is composed also of hydroxyapatite crystals that are embedded in collagen fibers. They are hard and tough, and dentin is produced by odontoblasts. Cementum is the hard bone-like material that covers the tooth's root and help anchor it securely in the jaw. It is secreted by cells of the periodontal membrane, the connective tissue that lines the tooth socket. And the strong collagen fiber extend from the jawbone, pass through the periodontal membrane, and they are inserted into the cementum, creating a firm attachment system. When teeth are subjected to excessive strain such as heavy chewing or grinding, the cementum layer can become thicker and stronger to reinforce the stability. With aging, cementum naturally increases in both thickness and strength, making teeth more firmly fixed in their sockets during adulthood and later life. This picture is showing all these three functional elements of the tooth: enamel, dentin, and cementum. Enamel is large, dense crystals of hydroxyapatite, outermost layer, and this is embedded in fine meshwork of almost insoluble protein fiber, while dentin is bony structure composed of hydroxyapatite that are embedded in collagen matrix in a collagen matrix. Then cementum is bony substance that anchors the tooth into the jaw. The pulp is present in the pulp cavity, and it is the soft living core of the tooth. It is composed of connective tissue that are rich in nerve fiber, providing sensation including pain, temperature, and pressure. And there is also blood vessels presence that nourishes the tooth and supply the oxygen and nutrients to the area. The lymphatics contributing to immune defense and fluid balance also. The Along with the pulp cavity walls are odontoblasts. These are specialized cells that during tooth formation secrete dentin. As dentin deposition progresses, the pulp cavity becomes smaller, and in adulthood, the dentin growth largely stops and pulp size remains stable. But odontoblasts, they stay active in maintaining mineral exchange through dentinal tubules that are tiny channels extending through the dentin, helping regulate the calcium, phosphate, and mineral balance in the tooth structure. In human, there are two sets of teeth in the lifetime. First set is called deciduous teeth or milk teeth. They are 20 in number, and their eruption starts between 7 months to 2 years of the age, and they last until approximately 6 to 13 years. And the second set, it is the permanent teeth. They replace the deciduous teeth as they are lost, and additional 8 to 12 molars erupt posteriorly in the jaw, and total number of these permanent teeth is 28 to 32 teeth. And the variation depends on presence of four wisdom teeth or third molars. uh, they may not appear in everyone. The formation of the tooth starts with the uh, invagination of the oral epithelium into the dental lamina. This process initiates the creation of a tooth producing organ, and above the developing tooth, the epithelial cell, they differentiate into amyloblast. The function of these amyloblasts is to secrete enamel on the outer surface of the tooth. Below the developing tooth, the epithelium invaginate upward into the middle of the tooth and form the pulp cavity. That give rise to odontoblast, and they secrete dentin. These pictures are summarizing the structures. The oral epithelium that is invaginated uh, above, they give rise to the amyloblast, while this is the alveolar bone, and this tooth that is erupted is present in this tooth socket. And the dentin is produced from the lower side, the epithelium that invaginated from the lower side, and this upper structure that is invaginated, the upper part of the epithelium that is invaginated, it is giving rise to the enamel that is the secretion of the amyloblast. So eruption of the tooth occurs during early childhood, and teeth move outward from the jawbone through oral epithelium into the mouth, and the exact mechanism of this process is unknown, but multiple theories exist. Most likely explanation of this is the growth of the tooth root and the growth of the bone beneath the tooth. They exert upward pressure that will lead to progressively push of the tooth forward into the oral cavity. The origin of the tooth, it begins during embryonic life. A tooth forming organ develops in the deeper dental lamina for each future permanent tooth. So there is slow formation of permanent teeth, continues from birth to about 6 to 20 years of the age. And when a permanent tooth is fully formed, it pushes upward, outward through the jawbone. As it moves upward or into the oral cavity, it erodes the root of the corresponding deciduous milk tooth, causes the deciduous tooth to loosen and fall out. The permanent tooth then replaces and erupts and replaces in the dental arch. So this process is under the influence of many hormone. Thyroid hormone accelerates the tooth development and eruption. Then the growth hormone also speeds up the tooth formation and eruption. The mineral and vitamin influence, calcium and phosphate, is also there, and it is essential for deposition of salts in early forming teeth. Vitamin D, as we know, it facilitates calcium and phosphate absorption, promoting healthy calcification. The parathyroid hormone regulates the calcium phosphate balance, indirectly affecting the tooth mineralization. So during the normal conditions, the healthy dentin and enamel is formed, and if there is deficiency, the defective calcification will lead to weakened or abnormal teeth throughout life. So how the mineral exchange in the tooth? What are the minerals? There are primary minerals that are the hydroxyapatite, the composition of the tooth salt. This is hydroxyapatite, and there are additional components such as absorbed carbonate and various cations, and they form hard crystalline matrix. And uh, there is active deposition and absorption of minerals that occur similarly to the bone metabolism. Enamel is responsible for minimal exchange, and it here there the exchange is mainly via diffusion with saliva, no, not the pulp cavity fluids. The rate of exchange of the mineral, it is determined by the cementum. The exchange rate is equal to that in surrounding bone of the jaw, and also dentin. It here only 1/3 of the exchange occur as compared to the bone, and this cementum is characteristic almost identical to those of the usual bone. So what is the cellular basis of this exchange mechanism? The cementum contains osteoblast and osteoclast that like uh, bone remodeling, and dentin lacks these cells, so there is slower exchange and the mechanism is unclear. So to summarize, this is a dynamic process or dynamic turnover that is present in dentin and cementum, and it is responsible for long-term stability because the enamel remains largely unchanged over a lifetime. There are two common forms of dental abnormalities. One is the dental caries, that is the erosion of the teeth. Then another is the malocclusion, that is improper interdigitation of the upper and lower teeth projections. The caries or tooth decay is the erosion of the teeth caused mainly by the bacterial action, and the main bacterium that is involved is Streptococcus mutans. There is initially a formation of the plaque, that is film of precipitate saliva and food products, and this plast function as host to large number of the bacteria, and these bacteria for their nutrition they prefer carbohydrates, so carbohydrate metabolism will lead to the bacterial proliferation. As a result, there is production of the acids that are the lactic acid that dissolve calcium salt in teeth, and also there is production of proteolytic enzymes that digest the organic matrix of the teeth, and as a result there is destruction of the enamel of the tooth. That is this enamel is a primary protective barrier of the teeth that is highly resistant to the acid due to dense crystal and large crystal size, approximately about 200 or larger times larger than the dentin crystals. The dentins are more soluble in acid. They decay rapidly once enamel barrier is breached. There is also dietary influence, and this caries is frequently linked more to the frequency of carbohydrate consumption than the total amount, and also associated with the frequent food intakes or intake of candy, and when there is prolonged substrate supply for the bacteria, that increases acid production, so that will result in more caries development. So there is a role of fluorine in preventing dental caries. The fluorine actually doesn't increase the hardness of the enamel. The fluorine ion, it increases the resistance to caries thrice. The fluorine ion replaces hydroxyl ion in hydroxyapatite crystals that will lead to formation of fluoroapatite, and this is significantly less soluble in acids than hydroxyapatite and increases the resistance of enamel several times, and it has also got antibacterial activities because it has got toxic effect on caries causing bacteria, that is streptococcus mutans. It has also got healing effect when small enamel pit forms. uh, the fluorine promotes calcium phosphate deposition, and this will heal the enamel surface. So overall, children drinking fluorinated water develop teeth that are about 3 times more resistant to caries than those without fluorine exposure. Another abnormality of the teeth is malocclusion. This is the misalignment of the teeth due to uh, hereditary abnormality or jaw displacement that results in improper interdigitation that will lead to insufficient grinding or cutting action. The cause may be heredity, that is the most common, or another cause is displacement of the jaw, so in which the lower jaw is misaligned with the upper jaw. The consequences of this is improper or inefficient chewing, and there is also pain in the mandibular joint, and there is tooth deterioration due to uneven wear and tear. The treatment is orthodontic correction. There is application of prolonged gentle pressure with braces, and the on the compression side the alveolar bone is resorbed, and on the tensional side a new bone is deposited, so there is gradual redeposition of the teeth to normal alignment.